insanity, substance use or IDD, so for various reasons. And they've committed a serious, very serious violent crime. And so now what what the proposal in S-193 was to provide a placement for them that the courts could have and help them. Of course, we're trying to help the courts here with the decision making. We're also trying to help victim families, and we're also trying to help the folks themselves who have committed the crimes. We want to have a place for them that is appropriate, and we want to ensure that victims' families aren't concerned about these folks who have committed a violent crime are returned to the community and can cause further problems. So that's what this is about. So we can go through and look at the amendment. So the first is we're being consistent with the Judiciary Committee that this will be under the purview of the Commissioner of Corrections within AHS and establish and operate a locked, secure forensic facility for the secure evaluation, treatment, and care of individuals who can transfer. It would be about 5 or 7 more minutes. Yeah, thank you. Okay. And so the facility should be designed and operated in a manner that supports a therapeutic, recovery-oriented, trauma-informed environment comparable to a community-based residential treatment setting while maintaining appropriate levels of safety and security. Will not refuse, and this is the language that we looked at yesterday, that this is the Judiciary Committee language, not to refuse any person. Then we've added in provide for a safe housing and management of persons, including the ability to separate the population by sex and to otherwise address clinical safety or operational considerations as appropriate, including the possible operation, and this is important, the possible operation of multiple facilities if required by the clinical needs of transferred persons.
Can you move forward? I didn't see that. Sorry about the
Yeah. And then, I'm on page 2, and then employ clinical services director to oversee transferred persons, and then to implement staff qualifications, licensure, training, supervision requirements that are sufficient to ensure that persons transferred to the forensic facility have access to clinically appropriate care, treatment, services, and supports consistent with individual collective needs and with applicable professional standards. I'm not legal counsel, so I can say and ensure that persons receive clinically appropriate assessment and treatment planning, including the development of an initial, and we added that in yesterday, the initial person-specific treatment plan within 72 hours following transfer, which will be reviewed periodically as clinically indicated. And that's important, so we know that they're going to be involved with their clinical oversight within 72 hours.
Sorry, could you just explain what the green is versus the yellow?
Oh, the green is what we added yesterday.
Okay.
The yellow is what we
Okay.
had from the day before.
That second green, though, the departments of health, of mental health, and I don't think you need that second off. I think you need a comma. Department of Health, mental health, and and disabilities, aging, and
Okay,
too
so-
many obs in there.
Oh, I'll ask, the editor will catch that. How's that?
If my grammar says it's wrong, you're in trouble.
Okay,
I can take remedial college.
Okay, we'll ask Katie that. So which way you're saying of mental health and of?
Well, there are two ofs.
There's 2 obs.
So it's,
Department,
yeah, no,
of
I know,
health.
there's,
then mental health
yeah,
and aging and disabilities.
gotcha. Okay, well,
True. Yes.
somebody remind me, we'll talk to Katie about that one.
Too many obs.
So we're getting honor before January 15th, DOC in consultation with those various departments. shall submit a written report to House committees on all of us and corrections, institutions, healthcare, health and welfare, or human services, health and welfare.
One-time report, right?
And,
No,
Oh,
well, let's leave it annually for now. And there's a reason for that, because it's a new process, a new program. Once it gets
for
going,
3 years. How many pages report?
become so fussy.
I'm
Okay,
just remembering, how many
I know.
pages of reports?
you're right.
Yeah.
So
Well,
I can't.
it was a lot of pages.
we'll leave annually for now, and then the House will fix it.
we wouldn't object.
And then, so we have the annual report coming in. And we're reporting on the number of persons served at the forensic facility. We know it's a fairly small number anyway, currently, which these folks who have committed violent crimes. What did you say in the calendar year, 3 to 5? Yeah. And then the types of clinical services and treatment during the previous calendar year. And that's important because there's going to be a diversity if you have, depending on what the needs are. And then we've struck out the rulemaking and added our own suggestions for rulemaking. So the Commissioner of Corrections, in consultation with the various departments, and there's no up in front of those. Oh, there is one in front of mental health, and yes, there is. Okay, well, that's good. Adopting rules pursuant to the Administrative Procedures Act. And then clinically appropriate standards governing the provision of services at the forensic facility, including requirements related to staffing patterns. So all the things that we asked for previously, and ensuring that we're getting the rulemaking process started. Standards for quality assurance, improvement, clinical oversight, documentation, reporting requirements, safety, risk management protocols, mechanisms for monitoring compliance, and any other provision necessary to ensure safe, effective, and clinically appropriate implementation, including, and this is the green part added yesterday, including potentially requiring the provision of a forensic facility services in a unit that is separate from the correctional populations. And then the interim report is by October. Department of Corrections, and then continuing on their collaboration with the other departments, sending us this report, the same committees. And the report will address, this is the interim report, the status and anticipated timeline for the adoption of rules under this act, the forensic facility planning, including specific proposed location of the facility, space considerations, design elements necessary to support the provision of therapeutic services and security at the proposed location, and the timeline for any necessary fit out. And this is one that we had all talked about, mentioned. Forget who said it, but it's real common, forensic facilities. Initial staffing considerations, anticipated staffing, required qualifications, potential contracting needs, anticipated timeline for the development of the facility, and then the effective date, July 1, 2026. Section 4A. I haven't memorized that yet. Section 4A goes into the definitions. Oh, so right, so a more discrete information by 29. And then all the other remaining, the rulemaking of there's some not rulemaking, so it doesn't affect all that. But the other sections go into effect on January 1, 2028. So that would be rulemaking. I'll have to sort that out myself. It's part of the underlying bill.
Yeah, I think the idea is that the facility would open then, and so the provisions allowing them.
Good. We don't have our legend counsel, so
No,
I'm on another lawyer.
No, I have a question, I think, for the department.
Go ahead.
think the testimony was we're talking 3 to 5 individuals. Is that 3 to 5 that come in every year? Or are there 3 to 5 people that are there a long time? I wonder what the turnover is, and if we've only got one person, does that become like solitary confinement?
So I think I'll answer that second part first. So I think kind of thinking about how that's all gonna work is part of the planning process. And I think, again, that's why we were hesitant to say it needs to be separate, because we're talking about such a small population. We want to have the flexibility to think about what that looks like. In terms of how many people, the idea, it will vary. We're anticipating about 3 to 5 people a year tend to qualify under these. Ideally, people who are coming in through the non-competency route are getting restored to competency. And so then they would be discharged from the facility, and then they would go on and their trial would proceed. If someone was found not guilty by reason of insanity, the length of stay would depend on their clinical needs and the public safety concerns. So it's hard to say because everyone's really individual and it depends on their specific
But they
circumstances.
could be there for life if they are a danger to the public. If let go, but they are also mentally ill to the point of having been found sane.
So I'm gonna,
At what point does this start to become a,
it becomes a problem.
yeah,
There's no question in it. Now, this isn't going to be the end of the conversation. And I know that judiciary's worked really hard on this, as we did last session. And that is an overarching question. Can people be restored to competency so that they can stand trial? Remembering also that they have, caused a crime, committed it, or
I mean, if you
are
were,
accused of committing an extremely violent crime and are potentially a harm to self and others in the community. So and other states have approached this, and I know that when Senator Hashim presents it on the floor, I'll be talking a little bit about how they got to where they are. And we've had a tough time with this. Your questions are right on target.
There is a yearly review by the court, so the court has to renew it every year. So it's not like once you're in and the individual at any time say, I think that I'm no longer a danger. So there are due process.
Okay, no, we're good. We got it. And so as I indicated earlier, this cannot be a committee amendment because we don't have possession. I'm going to introduce the bill, the amendment. If you would like to sign on, you can let me know. Does anyone want to sign on now?
Yeah.
Okay.
What I'd like to do is hear institutions, so I'm not
Okay.
caught between two.
You're fine. You can do that. I know Senator Harrison is signing on.
I've got the site. Psychologist bill, I voted no in here. I will probably vote yes in finance because we're looking at the fees.
Right, okay, so I want to close the conversation, but I'm asking you to let me know today if you'd like to sign on to the proposed amendment. You've got your afternoon committees. All right. And thank you. It's a long process. And we have just, you can let Senator Hinsdale know. And we'll have.
I think they're up in the hallway.
Is she in the hallway? Maybe we'll have her come up. She said 2 minutes. And before you folks leave, I just want to say thank you for being here for your day, the social work day. It's great to meet you all.
Thank you. I
Terrific.
appreciate the work.
You came in at a good time. Very much related to you.
Yes.
Yeah.
Thank
You know,
you.
Appreciate your.
Oh.
Good luck with school.
We can.
I'm with you. I got it. No, you've got to do your due diligence on that. That's another way. So, there she is. So Senator, we are so behind. If you could just take 2 minutes, that would be great.
And I
Okay.
sent a constituent to you. who's having
Thank you.
Problems with septic.
Oh, okay, well, send them to the right person.
I sent to you and Allison.
Where?
What's that? Didn't say what's that.
Okay.
Bought a house and now they tell me has to move it.
Are you live? Do you want me to?
That's right.
You tell me, Madam Chair, if you want me to just go.
Yes.
Okay,
Introduce yourself, but
great. Senator Keisha from Hinsdale, member of Economic Development, is my purpose here today, and reporter and lead sponsor of S-278, the cannabis market regulation bill. So I think my chair this morning, heard you're taking testimony and wanted to, and she's not in the building for this week. So just wanted to make sure that you heard our intentions around the bill and could ask any questions about the very, I think, thorough discussion we had about illicit substance use and how we are trying to bring more people into a regulated market. So, what I would say going back, and I guess the good news is some of us, Senator Cummings, Senator Lyons, myself, Senator Clarkson, even Senator Morley, have been here long enough to know when this was an illicit and illegal substance across the board. And all of our discussions generally, when we move to legalize, tax, and regulate something, have to do with the health impacts, whether we're better off in the illicit market or in the regulated market. Once we have a regulated substance that's legalized, it generally becomes an economic development question. So we do mixed martial arts, sports betting, alcohol, tobacco, and I see Tucker smiling because these conversations feel like judicial conversations, just the what ifs. But our goal is always to bring people into the taxed and regulated market and to support our local industry. And the local industry part became very important this year because we're starting to hear a lot of overtures from the federal government that they were looking at descheduling cannabis. Where I first heard that rumor before it was confirmed by some of President Trump's, I think, executive orders or advisories, is from the alcohol industry. And why? Because they have been looking for a long time at getting into THC beverage consumption. So we are about to enter, I believe, into a whole new world of discussion about how we manage public health risks while also recognizing this is a legal substance. You will see that we listened to the health experts. We got the same emails you probably did from medical professionals, and we took out the concentrate cap increase, and we took out the advertising provisions. Those were absolutely the two main things we heard from public health officials. I have to say, when we talk about the problem with simply normalizing use in a way that might affect youth, that's going to be really challenging to get around in this context. And I would say jurisdictionally, it's also important to think about medical marijuana. Medical marijuana is legal in 48 states. It was legalized first here before we legalized recreational use of marijuana. And so we've had a medical market for a long time that has its own discussion and debate around the health benefits or the health risks of cannabis. We, in the regulated recreational market, do not allow for the advertising of certain health benefits that cannot be proven. And so for the most part, you'll hear from the CCB, that is why they have the that's why they have a check on advertising, is no false claims or unfounded claims and other reasons. But we feel very passionately from the Economic Development Committee, hence this bill came out unanimously right now, that we need to help our craft cannabis market. Those are the people who care a lot about who they sell to, and they make sure that they are following the law because they cannot afford to lose their license. They are losing business to the states around us who have different regulations than we do.
and they are still losing business to the illicit market. We heard from, if you hear from cannabis retailers, they'll tell you their average age of their customer is late 50s. You know, they have a lot of people come in who are quietly enjoying cannabis, and that's the retailers. We've looked at other ways for people to consume cannabis because we have huge deserts where there is no legal access to cannabis at this
I'm
time.
gonna ask you to wrap.
Here is my last statement. My last, you know, a lot of the bill focuses on social consumption, right? Events, etc. The biggest killer, and doctors should be able to confirm this, I don't think this has changed. The biggest killer in this country is isolation. That is a bigger killer than tobacco. That is a bigger killer than alcohol. We have seen our cannabis industry follow all the rules, give people a third place, give people the opportunity to find community, and they have done it in a more constrained market than the states around us.
We got it. This is helpful. Thank you.
Yeah.
Actually, it is very helpful because it sets the parameters within which you folks evaluated the bill. And we do appreciate the elements that you took out that are very much directly related to prevention
Right.
issues. Right.
And we feel the rest is really our jurisdiction on a regulated, positive.
There are a
cannabis
couple
market.
places we might be continuing to look. Well, we
That's a message from my chair.
Thank you.
Yeah.
Thank you. That's good.
Yeah, thank you.
Alright,
Yeah,
so
thank you.
we will spill up the set. Finance is taking it up. Oh, this is good. No, we'll have several committees with an eye on it. Tucker, so, and I'm glad to see that, James Trevor is here. And we may send a friendship line out to you. Yeah.
For anything you need, it's.
I do. I mean, the question I have, Tucker, as we went through the bill, and there was that, obviously the areas for social engagement, having testing, tasting, the way we do with, alcohol, wine, having tasting, events for, cannabis is the regulation around those, I think, is important for us to understand. The other piece is on how many units can be sold, how many things can be sold together in a packet, because that has implications for over use or somehow sharing with minors. And I don't, and while you're looking that up, Pepper, do you have anything you would want to add? You can introduce yourself for the record and just briefly, and I know we're like behind time.
So James Pepper, Chair of the Cannabis Control Board. I mean, the nature of my testimony on a lot of this was providing regional comparison charts on all these various policy determinations, because every state does slightly differently. And I think one of the themes that economic development was looking at was how do we harmonize regulations in New England so if that there is interstate commerce, particularly among adjacent states, abutting states, that we can have, you know, some similarity in how these markets look. So when it comes to packaging limits, per package limits and delivery and events, it's really trying to coordinate with our neighboring states.
Okay, and so from your perspective, does the packaging match what we're seeing in other states around us?
So only one other New England state has this limit, and it's Maine. New York, New Jersey, Connecticut, and I think there's the slide that was looking at Vermont. Is that 100 or 100 milligrams of THC?
Okay.
So we're gonna be fine.
So New Hampshire does not have an adult system, and Massachusetts is at 100. Some of them have higher per serving. You know, some of them have 10 milligrams per serving. There was a concern about raising the amount of THC in a single serving. There was less concern around raising the amount in a single package in the other.
Yeah, okay.
Still goes well,
Well, and this bill is in finance. We may actually have another crack at this bill. So it'd be good to get you in and talk to us.
And appropriations as well.
Yeah.
So this bill has a few more stops.
This bill has more time. Oh, Tucker, maybe take us to those two places.
Sure. Good morning, Tucker Anderson, Legislative Counsel. You should have in front of you draft 3.2 of the Economic Development Amendment for S-278. I'll take you there. We'll start with section 1 because that's where the packaging limit is. And one note about the states around us, the limit in Massachusetts is 110. And I remember that because it was in the bill as introduced, as an adjustment from 100 to 110. Section 1 increases the amount that can be within a single package to 200 milligrams of THC. As the chair of the CCB just noted, that is the limit that is in place in Maine. Something to note about how all of these sections work together is that this is not a limitation at all on how much an individual can purchase. It is a limit on how much THC can be within a single package. And was this in one of the CCB reports about packaging reduction? No. Okay. That was the part of the discussion in economic development. I couldn't remember the source, but the discussion was around if you can buy, let's say, 50 smaller packages and be below the transaction limit, would it make sense to increase the amount that can be within a single package to reduce the number of packages and individual purchases? So that's the packaging provision in the bill. And it leads into the next 3 sections because this is where the limitation exists in law around how much an individual can purchase in a single transaction. I was very purposeful in stating in law because law does not equate to practice. And again, unless you are going to have an enforcement officer issue a civil violation for going over the possession limit, the transaction limit exists almost exclusively in law and for purposes of the point of sale and retail.
There's like 3 outlets, at least in my feeling. There's 2 in the same block downtown, if I was reading. So I could purchase the limit at 1, walk next door and purchase the limit there, and then drive out to River Street and purchase more there. Actually, I think there's 4. So
We're retreading the conversation that happened in the other committee, which is that the transaction limit is trackable and applies to the seller and the purchaser at an individual retail location. And so you could have an individual go between multiple retailers. So the transaction limit provision increases from 1 ounce to 2 ounces. Sections 3 and 4 amend the provisions, the enforcement provisions related to the penalties for going over the possession limit from 1 ounces to 2, so that an individual who purchases the maximum in a transaction doesn't automatically trigger civil enforcement for possession.
But if he does what Senator Cummings just said, he will, correct? Right.
but it would be,
I hope, maybe. Okay.
I doubt that anyone. This is getting to be like used to whether or not this is something that police are going to choose. Right. To enforce.
Something that I note in the alcoholic beverages space, there's 2 ways that an individual can violate the Constitution. One of them is by importing alcoholic beverages against the laws of the state. And there are, in fact, laws against importing alcohol into the state of Vermont against state law. But there are many, many people who do it. So there's always possibility for a gap between state law and the ability to enforce state law against individual commercial market. So those are the packaging and transaction limit provisions. The next sections that you asked me to revisit are in sections 5, 6. They relate to the 2 pilot programs allowing the CCB to issue event permits and delivery permits. For the event permits, the highlights are that this would last for 2 years. In each of those years, there would be a limit maximum limit on the number of permits that would be issued by the CCB. For the events, it's 20 total. And there's a bright line split between public events and private events. 10 of each is the maximum. The language in this section is written broadly enough to allow the CCB to essentially experiment with the marketplace. Not so specific as the alcoholic beverage events permits, where you have special events, special venues, festivals, limited events, and a number of other, for example, retail event permits that are all very granular and specific about time, place, location, serving amounts, etc. So this was drafted broad authority for the CCB with procedure adoption authority around security, permit restrictions, things like that. So I know the question came up about what types of events this covers. It's fairly broad. It could be the farmer's market. It could be a sampling event. It could be catering a wedding.
That one really bothers me a lot. Wide open west. Go ahead.
There are certain events that I see as well that have beer tents. And you know, you can try all kinds of different types of things.
Yeah.
I mean, I've seen it at fairs,
Yep.
I've seen it at other.
Festivals.
Yeah, exactly. And I guess I'm mentioning something like that also. Was that discussed in any form of testimony in other committees? Okay.
It could include that. It could be a festival where a single permittee takes out the permit and is responsible for meeting all of the eligibility guidelines. And then there are sub licensees that are operating within that space, similar to a beer or wine festival.
What if the organization didn't want them there? So I mean, I'm just thinking like, what if a fair association, we've issued, someone can say, we've issued this license to go do this at this event, and then the association, the fair says, we don't want you there.
Yeah.
So then they can't go in there, obviously.
Yes, I think that all of those things are built into the eligibility, including in the statutory requirements that the cannabis establishment pulling the permit has approval from the local control commissioners and has met all of the conditions that have been put in place by either the local control commission or the local select board. And of course, if this is public property, if this event is happening on, they would have to get that approval from the
And
municipality.
basically, this is a marketing strategy, as far as I'm concerned.
Yeah.
Right.
So I don't like to do this to you. But we have to, because we're on the floor at 11, and I have some folks who have come in, especially today, to present. But what I'm going to ask you is if you might have some time tomorrow, I'll have Calista check and see if there's time tomorrow, and you as well, James. And so that we can have a discussion, committee discussion about this, because there's a lot here. And we do that with sincere, hopefully you will understand where we are.
Also things.
Because I do want to get to the Vermont Youth Conservation Board. Christine had us here, especially today, and it's a big deal for us. And Christine, we only have, and we're on the floor at 11 o'clock, so, but we've got some time. And it may be that this is the first time of another.
Wonderful.
Yeah, you come in.
Well, we appreciate you making the time that you have this morning to meet with us. So I'm here. Good morning. My name is Christine Hadwell. I'm the director of the Food Farm Program with Vermont Youth Conservation Board. And I'm here today with Brett Knopf and Leanne Mattel, two of my colleagues at BYCC. And we're delighted to meet with you this morning to share a little bit about what we do. So we have an 11-acre farm in Richmond. That is an organic farm that produces thousands of pounds of food for Vermonters every year. It's an agricultural training hub for young people, but it also serves as a hub for the Healthcare Share, which is Vermont's largest and longest running food as medicine program. So what is food as medicine? That is a program where healthcare providers prescribe a share of produce to a patient who has a diet-related illness or disease. And those patients are also food insecure, so they don't have the ability to purchase food. And so this share of produce that they get every week is an opportunity for them to work with their doctor to manage their diet-related condition through food. So VYCC produces healthcare shares throughout the year we deliver to over 450 families every year, including to North Country Hospital in Newport, NVA in Newport. We deliver to SASH. We deliver to CVMC in Barrie and all sorts of sites in Barrie and throughout Chinook County. We also deliver to Northfield. So a lot of different regions. We're currently delivering to 5 counties in Vermont.
Wow.
And programs like ours are gaining nationwide attention because there's a lot of evidence that's coming out that shows the impact that food can have to drive down healthcare costs and healthcare utilization. So if we could use food as prevention, folks don't end up in the emergency room due to diabetes and other diet-related illnesses, hypertension, things like that. So we've got the data to prove it. We have data from our program participants that have shown reduction in A1C levels, so blood sugar levels going down, reduction in weight, increased energy. All of that is coming through in the data we collect every year through our program. And at the same time, we are hearing that this program is really helping families that don't have enough food to put on the table for their household. So families that have said, my food stamps were cut twice last year. This program has helped me to have fresh vegetables so that I can use my SNAP benefits for other groceries that we need in the house. So why are we here today? The challenge, transportation. I'm sure you are aware. So we already have healthcare partnerships with clinics and hospitals across the state. We've got our farm production systems. We have our distribution systems. We've got trained staff. We hire 80 to 100 young people on our farm through AmeriTour and different programs to come and do the growing, the packing, the distributing of all of that. We have everything in place except for that key piece of distribution. Currently, we use one leased cargo van to distribute our food across the state. And that van is zipping across the state, doing multiple runs, having to sort of go back, crisscrossing, making multiple trips throughout the week because we don't have enough space to fit all of the shares in one van every week. We also have increased need. We hear from doctors and healthcare clinics throughout the year that are interested in signing up, but we have this bottleneck of transportation. We would love to be able to serve more families, but we can't because we don't have the ability to get the food to folks that need it. So if we were to get 2 additional vans, we could run routes simultaneously, organizing deliveries by region, being much more efficient, reducing travel time, bringing food distribution points closer to patients. We've heard from many clinics that families don't have reliable vehicle access. And so being able to bring those shares closer to where they live, to a clinic that's closest to them is really our goal. So our request to you today is for you all to consider a one-time capital investment of $100,000 so that VYCC can purchase 2 cargo vans for the healthcare share. This would enable us to expand our program to more healthcare partners across the state, to serve more Vermonters facing food insecurity, to reach more counties, and to deliver more Vermont-grown produce. At the same time, connecting local farms with healthcare, which is such a vital connection that we have the ability in our state to be able to do if we have these investments that are needed to make that happen. The ability to scale our program would be tremendous with these 2 additional cargo vans. We are already making strategic investments. Our East Monitor barn, if you ever drive along Route 2, you'll see a beautiful barn that's being restored. That's our historic East Monitor barn. We are making significant investments in that barn currently to be able to have a winterized wash pack space where we can collect more food from local farms, process that food, package it up to get it out to more clinics. We're investing in more coolers for that barn. So everything is in place except for this final piece of distribution. So in closing, I'll just say food is medicine, but only if we can actually get it to the people who need it. Transportation is the critical link, and I would encourage your committee to consider making this one-time investment for our program.
So if we had the money, we could do it. It's all down the hall appropriations, but what I'm going to suggest is that you've introduced us to your program. And I've heard you say you deliver to clinics. So what we're going to want to do is to dive into exactly how this works, how the decisions are made about prescribing food, how it's distributed, where, and so on. Then that will allow for us to make a more informed recommendation down the hall when the time comes. And as one person who has a lot of experience in this area, I would say this is really, it's really outstanding what you are doing and appreciate it very.
Thank you very much. What's going on in that barn?
Yeah.
Yes,
Every time I drive by.
now you know.
Go ahead, Senator.
And I just forget, I had one final, thing to share, which is on April 8th, we will be here, in the State House for Food is Medicine Awareness Day. And there will be programs from across the state that are doing this good work. And there's a statewide task force working on this currently.
Yes, sir.
They are requesting to actually meet with this committee on April 8th, so there'll be more opportunities to hear about food is medicine more broadly on April 8th.
April 8th, you said?
That's correct.
Christine, one question you may want to prepare yourself for going to appropriations may be, because I imagine you're traveling a lot of distance. I'm used to ambulances.
Yeah.
And you put up miles fast. Is how I don't know how you seek your or you receive your forms of revenues. I don't know that, but how are you going to replace the two that are bought? Is there a plan? And what if the legislature and the appropriations committee gives you the 100,000 that you're requesting? How long is that good for? And then are you going to come back again for more requests, or do you have a funding strategy and a plan to keep that investment going?
He's been on appropriations before, so you're getting all the good questions.
I just want to.
No, great
That's
question.
what makes me like,
It's a
yeah.
great question, and I'll just briefly respond to say we have a really great asset management plan in place at BYCC. So we actually have a fleet of over 50 vehicles that we use for our youth to be able to go out to do projects across Vermont. And for each of those vehicles that we get, whether that's through a donation or an investment, we then put aside funding over
Perfect.
time so that as that vehicle gets phased out, we can purchase.
So you're flipping vehicles.
That's
so
right,
often.
that's right. We have a whole vehicle at the.
Wonderful.
Yeah. Okay. Oh, okay, that's great. This has been exciting. And I appreciate you all being in here. It's great. Thank you. Thank you very much. You'll be back.
Thank you for your
All right.